In February 2020, as COVID was grounding travelers, members of the Henry Ford Global Health Initiative team were returning from overseas. John Zervos had been in Latin America.
My team was in Colombia building partnerships both in oncology and cardiology to enhance both the cancer care as well as prevent heart disease within Colombia.
Kate Zenley was in Southeast Asia, sharing best practices for caregivers.
We have partners in Bangalore, India. We were learning a lot of their processes, a lot of their methodologies, engaged in a lot of workshops and site visits with them abroad.
For the past 8 years, the Global Health Initiative, or GHI, has been sharing Henry Ford Health System expertise around the world, building relationships with local leaders in order to help improve healthcare.
The biggest challenge for both vulnerable populations internationally and locally is just access to healthcare.
Throughout the pandemic, the team has stayed in this country to meet the global challenge. In March 2020, GHI teamed up with the City of Detroit's Health Department to stand up what's believed to be the first rapid COVID testing clinic in the country, tapping into the resourcefulness team members use in third world countries.
This was a Sunday that we got the call, and we had that place up and running by Tuesday. And the reason that we were able to do that was really just from partnerships.
Eventually, they expanded their efforts to 26 nursing homes, plus prisons, schools, and churches, conducting 40,000 COVID tests when all was said and done. At about the same time, Henry Ford leaders asked for help with a monumental task.
They had already seen some of our successes, even over a short period of time, and really had the conversation with us if we had the capacity and the resources to lead the clinical trials.
The team, which includes vaccine and infectious disease researchers, needed to find space, staff, and volunteers for the Moderna and Johnson & Johnson COVID-19 vaccine trials. They were especially focused on enrolling folks from minority communities.
When you see especially the disproportionate impact that COVID-19 has had on minorities and people of color, you quickly realize that they need to be represented in these trials, maybe more than other groups, because it's clearly impacting them more.
They recruited more than 1,100 volunteers for the trials, opened 3 offices, and were recognized for best practices. With vaccines approved, the job shifted to getting shots in arms.
When you look at the vaccine rollout, for example, some people might not have access to a computer. They might not trust the vaccine.
So again, just like overseas, the Global Health Initiative team is knocking down barriers by working with community leaders. Vaccine vans are traveling to 6 sites across Southeast Michigan each week, including the Islamic Center of America in Dearborn.
People feel comfortable coming in and knowing that all the imams are vaccinated, so that's another layer of trust for the community.
When the pandemic began, there were about a dozen people on staff at the Global Health Initiative. The team has grown to about 60, stepping up right here in Michigan to meet the challenge that has gripped the entire world.
There have been numerous times this year that I just had to kind of sit back and just think of where we've come and just how proud I am of really everyone on our team.
The team has about 30 overseas projects that have been on hold since the beginning of the pandemic. They're hoping that they could keep some of those new team members on staff when they return to their global efforts. For Henry Ford Health System News, I'm Dana J.